the first bone, clavicle. Okay, clear? So as you all know, clavicle is is like an F-shaped, an italic letter F-shaped bone. Just a second. Okay, so it is like an italic letter F. Okay, like this. So the medial two-third of the clavicle, the medial two-third of the clavicle is convex forward. This is anterior, so this is convex forward, and the lateral one-third of the clavicle is concave forward. Is concave forward. Okay, so the lateral one-third is concave forward, and the medial two-third is convex forward. So there is a change in the convexity of the clavicle at the junction of medial two-third and lateral one-third, and because of this, the fracture are more common at this junction. So clavicle fracture most common at the junction of medial two-third and lateral one-third. At the junction of medial two-third and lateral one-third. In other words, you can say that clavicle fractures are most common in the middle third. In the middle third, so this is the middle third of the clavicle where the fractures are common. And how clavicle fracture commonly occurs? It occurs by fall on outstretched hand. It occurs by fall on outstretched hand. Okay, it occurs by fall on outstretched hand. Okay, now whenever clavicle fracture happens, okay, so normally we treat the clavicle fracture conservatively. Mostly we treat the clavicle fracture conservatively. Without doing surgery, we treat the clavicle fractures. But there are certain conditions, we go for surgical treatment. We go for surgical treatment. That is, we fix the clavicle fracture using a nail, an intramedullary nail, or by using a plate. Okay. So you treat the clavicle fracture surgically by using either nail or plate, but in certain specific conditions whenever the clavicle fracture causes more than 2 centimeters of shortening, okay, more than 2 centimeters of shortening, you treat it surgically. Or if there is a skin tenting caused by the fractured ends, you treat surgically. If there is an open fracture, you treat it surgically. If there is an associated neurovascular injury, you treat it surgically. If there is an lateral end clavicle fracture, you treat surgically. So these are various conditions where we treat clavicle fracture surgically. Normally, we don't treat it surgically. We treat it conservatively, but in certain conditions, we treat it surgically. And these are the various criteria to treat the clavicle fracture surgically. And how do you treat it conservatively? You treat it conservatively by applying a bandage called as figure of 8 bandage. We apply a bandage to the clavicle called as figure of 8 bandage. I will show you a picture. So this X-ray shows the fracture clavicle in the middle third. You can see the fracture ends which are displaced so much, and usually when there is so much of displacement, this will cause tenting of the skin, and because of the skin tenting, you treat it surgically. Okay, if the fracture is not that much displaced, or if it is not that much shortened, then you treat by applying this kind of brace, which is called as a figure of 8. It appears like a figure of 8. Okay, so that is why this is called as figure of 8 bandage. Okay, so you treat the clavicle fracture mostly conservatively, but certain conditions you should remember. So these are the various conditions where you treat it surgically. Proximal humerus fracture. Okay, so I hope you all know the anatomy of proximal humerus. Can anyone tell me what is this? This is head of the humerus. This is greater tuberosity of the humerus, and this is the neck of the humerus, and you get a tuberosity here called as lesser tuberosity. Then the shaft of the humerus goes. Now there is a neck which is running here, and there is a neck which is running here. Can anyone tell me what are these two necks in the humerus?
Anatomical neck, surgical neck.
Very good. This is called as the anatomical neck, and this one is called as the surgical neck, and this one is called as the surgical neck. Very good. So around the surgical neck of humerus, there is an important nerve which is running, and this nerve is called as the axillary nerve, and this nerve is called as axillary nerve. So in and proximal humerus fracture, the nerve that can get injured is axillary nerve. Okay. Along with axillary nerve, one more nerve can get injured in an proximal humerus fracture. That is musculocutaneous nerve. Okay. So the nerves which are commonly injured in the proximal humerus fracture are first most common axillary nerve. The next nerve which can get injured in a proximal humerus fracture is musculocutaneous nerve. Okay. So the importance of anatomical neck is, if a fracture happens in the anatomical neck, then the head of the humerus can lose its blood supply, okay, can lose its blood supply, and this results in avascular necrosis. It can result in avascular necrosis of humeral head. That is the importance of anatomical neck. So when a fracture occurs through the anatomical neck, the head of the humerus can lose its vascularity, resulting in a condition called as avascular necrosis. Avascular necrosis is also seen in few other fractures like femoral neck fractures. It is also seen in scaphoid fractures. It is also seen in talar fractures, talar neck fractures. Talar neck fractures can have avascular necrosis. Okay, so this is very important. Repeatedly asked question. Avascular necrosis of the bone is seen in certain fractures. One is femoral neck fractures, fracture, talar neck fracture, fracture of the humerus in the anatomical neck region. Okay, repeatedly asked MCQ at this point. So whenever you get a proximal humerus fracture, there is a classification for proximal humerus fracture. That classification is called as Neer's classification. So just keep this in mind. There is a classification called as Neer's classification for proximal humerus, and they classify the proximal humerus fractures they classify it as 2-part fractures, 3-part fractures, and 4-part fractures. So how they classify the proximal humerus? Neer classified it as 2-part fracture, 3-part fracture, and 4-part fracture. Just if you see this diagram, you can understand. Now this is the proximal humerus. It is divided into, this is one part, this is the other part. This is one part, this is other part. So you've got 2 parts in it. So those kind of fractures called as 2-part fractures. They are called as 2-part fractures. If you see this picture, you can see the fracture has got 1 part, 2 part, and 3 part. These kind of fractures are called as 3-part fractures. If it breaks into 4 different parts, then they are called as 4-part fractures. So very simple. Neer classified the proximal humerus fractures as 2-part fractures, 3-part fractures, and 4-part fractures. Now, how are you going to treat it? Whenever a proximal humerus fracture occurs, if the fracture fragments, this is very important, if the fracture fragments displace more than 1 centimeter, if the fracture fragments displace more than 1 centimeter, if the fracture fragments gets displaced by more than 1 centimeter, or if the fracture fragments gets angulated by more than 45 degree, if they get angulated by more than 45 degree, then this is an indication for surgery. You saw for a clavicle fracture, we saw some indications for surgery. In a very similar way, In a proximal humerus fracture, if the fractured fragments get displaced by more than 1 centimeter, or if it gets angulated by more than 45 degrees, then you do surgery. And what are the various methods to do surgeries? Usually, we use screws and plates to fix the fracture. Screws and plates to fix the fracture, and you open the fracture and reduce it. So it is called as open reduction. So you open the fracture and fix it. So it is called as open reduction, and you fix it internally. So it is called as internal fixation. So it is called as internal fixation. So if you go to ortho wards, in the case sheets, you will see this term ORIF. ORIF stands for open reduction and internal fixation. Usually the proximal humerus fractures are treated by open reduction internal fixation methods using screws and plates. Most common way to treat a proximal humerus fracture. Are you clear on this? Fine. So sometimes when you treat this fracture, as I already told you, the fracture, if it happens to the anatomical neck, it can result in avascular necrosis. Avascular necrosis means what? The head is totally lost. It is lost, it is destroyed because of loss of blood supply. When the head is lost totally because of it, you do replacement surgeries. You do replacement surgeries. So replacements can be hemiarthroplasty, that is, you replace part of the joint, or you replace the total joint, which is called as total shoulder arthroplasty. Total shoulder arthroplasty. So if you replace only one part of the joint, that is called as hemiarthroplasty. If you replace the total joint, that is called as total shoulder arthroplasty. There is a last resort to treat this fracture. So this is about the proximal humerus fracture, shaft of the humerus. Okay. See, again, a small anatomy of the shaft of the humerus. You must know. So this is the proximal humerus, the head of the humerus, the anatomical neck, the greater tuberosity, and the surgical neck. So this is the shaft of the humerus. This is the shaft of the humerus, and there is one important nerve which is running from the medial to the lateral aspect of the humerus in its mid shaft, in its spiral groove, and this nerve is called as, can anyone tell me? Very good. This is called as a radial nerve. So whenever there is a fracture of the humeral shaft, what is the nerve that is commonly injured? Radial nerve. Radial nerve is the one which is commonly injured. Humeral shaft fractures is treated with two types. One is conservatively, it can be treated by using hanging cast, or it can be treated with intramedullary nails, or it can be treated with open reduction, internal fixation with plates and screws. So these are various methods to treat humeral fracture. So humeral shaft fracture is very simple. The nerve which is commonly injured in humeral shaft fracture is the radial nerve. And how can you treat it? You can treat it by using hanging cast,
intramedullary nails, or with plates.
So if you see this picture, you can see how an hanging cast is being applied. This is how an hanging cast or in U slab is applied, where the fracture is treated conservatively without surgery by using a POP, plaster of Paris. You can also treat this fracture by surgical means by using an intramedullary nails or ORIF with plates. Okay. Now, there is one important MCQ in the humeral shaft fracture, that is called as Holstein-Lewis injury. Holstein-Lewis fracture. What is called as an Holstein-Lewis fracture? Now, this is the humeral shaft, and the humeral shaft at the end ends in the distal humerus, where you got medial epicondyle, then you have the trochlea, then you have the capitulum, and the lateral epicondyle. Now, fracture of the humeral shaft at the junction of the middle third and distal third. Okay, so just see this one. It is at the junction of the middle third and distal third. A fracture happens at this, and it results in a small spike in the fracture, and that can injure the radial nerve. This injury is called as Holstein-Lewis fracture. So Holstein-Lewis fracture is fracture of the humerus at the junction of the mid-third and distal third. Mid-third and distal third junction, and because of this fracture, radial nerve gets injured, Such a fracture is called as Holstein-Lewis fracture. So the MCQ comes like this. In an Holstein-Lewis injury, what is the nerve that is injured? Answer is radial nerve. Very simple. Okay. So in an humeral shaft fracture, if it happens at the junction of the middle third and distal third, and this fracture causes radial nerve injury, such a lesion is called as Holstein-Lewis injury or Holstein-Lewis fracture. Okay. The MCQ is very simple. The nerve injured in Holstein-Lewis fracture. Okay, clear? Fine. So this is about the humeral shaft fracture.